history, he has recently hit his head. Therefore, I want to perform a CAT scan. No, a CAT scan.
Meow.
CAT scans are great for telling if there's brain bleeds. Also, they're quick and they're good for trauma.
Wait, don't we need to let him know about the risks first?
Of course, that's a great point. Only 7% of patients know the risks or benefits prior to having CT imaging. Therefore, we should let the next of kin know. Zach, you just woke up from your 3-day coma and I want to go over your CT imaging. Is that all right?
Yeah.
Okay. So right here is a picture of your brain. Up here is the front of your brain and down here is the back of your brain. When you hit the back of your head, you got a brain bleed right here. Do you see that?
That's my bleed?
Yeah, the brighter part is your bleed. On CT scans, blood shows bright.
Okay.
Does that make sense?
That's what it looks like right now?
That is what it looked like right after your injury. So when you hit the back of your head here, it created a brain bleed, which we call a hemorrhage. And then you also, your brain sloshed forward and hit right up here, which is the frontal lobe. So what happened, this is your coup and this is your contra coup. That's what we use in medical terms. So the coup part is the back of the brain or the initial injury, and the contra coup is where your secondary brain injury occurred. Does that all make sense to you?
Yeah.
All right, great.
I heard that MRIs don't use any radiation, so why didn't I get one of those instead?
Well, CT scans are the preferred imaging for your suspected diagnosis, a brain hemorrhage. They are highly sensitive and widely available. So unfortunately, you were exposed to some radiation, and so you are at a higher risk of cancer, but it was just the best option.
Am I gonna have to get another CT scan today?
No, we will only perform another scan if your clinical signs deteriorate. So actually right now what I want to do is perform a neurological exam to see if everything's okay. Is that all right?
Yeah, that's fine.
Okay.
Starring Celeste Balmer as the radiologist. Zach Douglas as the patient. And Michelle Brooke as the camerawoman and the voice.
Whoa, what are you doing? So Zach, you have just woken up from your, I don't know what I'm saying.
Am I gonna need another CT scan today?
No, we actually won't perform one unless your clinical signs deteriorate. Otherwise that puts you at more, sorry. Do that, yeah. So you're out of the screenshot. Stop! I see the patient's past medical history shows a